And what's it like living in Loma Linda in terms of recreation, shopping, and housing?
It's good. I haven't had any trouble with housing. I've always lived in the same house since I've been here. It's a friend of mine's parents own the house, and they've been willing to rent it to myself and some of my other friends, so that's been good. Shopping, there's not a ton of shopping. There's really not a ton of recreation either, although Loma Linda is a pretty small city, and so there's a lot of surrounding areas that have that sort of thing. San Bernardino, Redlands, what have you. So it's been good.
And what would you consider Loma Linda's strengths?
Well, I feel like it's a bit of a pocket of nicer area and a bit of a rougher area with the surrounding, I don't know, maybe it's just the university has a lot of security that's kind of around the entire city, which I think helps. So I think that's a big strength compared to the surrounding areas.
Somewhat of a diamond in the rough?
A little bit, yeah, definitely.
What about its weaknesses?
Weaknesses, I think a little bit like what we mentioned before. There's no real, downtown area that has really anything to go do anywhere in the town. It's more just you got to go elsewhere in order to find places where people congregate or whatever.
So not really any entertainment.
Right. Exactly.
And do you know anything about the employment of the people of Loma Linda, like how that status is right now?
I don't really know much. I would assume that most people that live there are probably involved with either the hospital or the university in some capacity, but I don't really know.
Okay. And do you consider healthcare, with it being a medical town, let's say with all the health facilities there, do you consider the healthcare to be accessible to all? Or is it only to those who could afford it? Like, do they have a lot of public health services?
I think from my perspective, definitely it's pretty much available to everyone. As a student at the dental school, I really deal with a lot of sort of lower income people that have come to the dental school to get cheap dental care. So from my perspective, yeah, it's definitely accessible to everyone.
And do you have any idea what the greatest health problem in the area would be that you've noticed throughout your time there?
Well, I got to go back to my roots here, I guess. Definitely teeth. I've seen a lot of people with a lot of problems in their mouths. So, again, that might not be right in the principality, so to speak, of exactly Loma Linda, but some of the surrounding areas definitely could use a lot of work on their teeth.
So do you consider their oral health to be more of a problem than their overall physical health?
Probably not, I guess, when you put it that way.
Well, do you think they're neglecting that more?
I think, yeah, definitely with some of the lower income people, I mean, you have to prioritize what's important. So your general health is probably going to be more important than the health of your mouth specifically. I have a lot of patients that I see that haven't seen a physician in a long time either, though. So I think you kind of go either way on that.
Okay. And what seems to be the gossip center of the town, or an informal communication network where people congregate and socialize?
Good one.
Even though there's no downtown area, like you said.
Yeah, again, I mean, there's not really a lot of like social areas. I would say it's probably the university itself. Most of my friends that I know are people that I go to school with, so I imagine that's probably pretty similar to most of their students of the school, or it would be more of a work environment, school environment type thing than an actual community.
Does the school host a lot of socialization activities for you, for the students?
Yeah, a fair amount. I mean, not a ton. I mean, there's weekly gatherings for chapels and stuff like that, but yeah, I guess so.
And is there any influential people in the community that really speaks out in the community, or?
Again, since it's so university focused in the whole town, it's definitely the leaders of the university and the faculty members, stuff like that, are pretty much the leaders of the community as well. I know there's one of the city councilmen is actually one of the deans of the dental school, so there's definitely a lot of overlap between the government and the university.
Okay. So what would you consider the major industry of the community to be?
Definitely healthcare. Pretty much everyone is involved with healthcare.
Okay. And how would you describe the overall population of Loma Linda as a whole? Like, would you consider them to be majority students, or is there, like, how would you describe their demographics?
Yeah, I mean, obviously any sort of college, university town, there's a lot of students there. But general demographics probably, I would consider it to be a bit of a higher income area, especially compared to the surroundings, and that's just because there's a lot of PhDs, physicians, dentists in the area, because of the school is training mostly those type of people, so that tends to be the type of people that stay there. So definitely a little higher income.
All right. Thank you.